Folks, thanks for joining us today. I have the pleasure of bringing to you today Mr. Bob Riney and Dr. Adnan Munkara and their special guest, whom I will allow them to introduce here momentarily. We're going to update you on our numbers, our hospitalization rate, et cetera. And then after everybody's remarks, I'll go ahead and take questions. As you all know, if you've been with us before, I usually call on you to ask your questions in the order in which I see them. So you can leave me a message in the chat or raise your hand virtually, and I will do my best to call on you when we get to that point. With that, I will turn it over to Dr. Munkara. Adnan.
Thank you. Good morning, everyone. Before we get started, I would like to introduce a physician colleague who has been on the front line and who is joining us today for a briefing. Dr. Jacqueline Flum-Colston is a critical care and emergency medicine physician. We wanted her to be with us this morning so that she can share with you from the front line what she and her colleagues are experiencing day in and day out, now 19 months into this crisis. First, I would like to start by sharing some positive news. Since we started vaccinating children aged 5 to 11 years old, we have administered over 1,000 doses of vaccine for this patient population. And we are very excited about that because, as we said from the get-go, vaccinating our children is very important to protect them, but also help protect the community, especially as we are seeing these breakthroughs and in our schools. We also have seen an uptick in overall vaccination rate in the past several weeks. In the past 2 weeks, since December 5th, we have administered about 8,100 doses of vaccines. This is 27% increase compared to the 2 weeks prior to that. Some of these are booster vaccines, and a fewer are vaccines that people are taking for the first time. This week also marks the year anniversary for giving the first COVID vaccine here in Michigan and in our institution. Overall, we have given 380,000 doses to employees, patients, schools, community partners, businesses, places of worship, and more. And we are very excited and we are very proud of our teams who have contributed to that. And we are thankful to every one of our employees who have followed our mandate to get the vaccine because they are contributing to protecting themselves, the patients, as well as our community. These are significant achievements and we are proud of them. Now, I'm going to shift gear a little bit to the news that are not that good. In fact, they are very concerning. We continue to see a rise in our hospitalizations with COVID patients. As of this morning, we have a total of 500 patients with COVID, either in the hospitals or waiting for beds to be admitted. This represents about 34% increase in just the past month. And these numbers are not easing off. These are not coming down, and we are very, very concerned. The trends that we are seeing by other healthcare systems locally, as well in other states and nationally. And this is straining our healthcare systems significantly because this is taking away from resources that are needed for non-COVID patients. Statewide, in Michigan, hospitalizations are up by 10%, and COVID-related deaths are up about 80% in the past 2 weeks based on data that we have looked at. About 75 to 80% of hospitalized patients with COVID are unvaccinated. And over 85% of patients who are in the ICU or are on ventilators in the ICU are unvaccinated. And this reflects to us, as we have said before, and I know you're getting tired of hearing it, that this is a pandemic of the unvaccinated. And this is extremely important to know because this means we have a way of stopping this rise. We have a way of bending the curve or bringing the numbers down, because the unvaccinated people continue to make the majority of these admissions. And this is what is causing the problem that we are seeing at the present time. We also looked at our numbers because people keep coming to us and saying, well, if you're vaccinated, you'll still have breakthrough and there's a potential for you to be hospitalized. Yes, you do. But based on our numbers, as well as numbers that have been shared by many other health systems nationally, people who are vaccinated are 30 times more likely to survive COVID admission than unvaccinated patients. So this means that vaccines one, protect you from an infection. But even if you get a breakthrough infection, the outcomes are going to be much, much better, and you are going to leave the hospital alive. With respect to our capacity at the present time, Bob is going to speak a little bit more about that, but I wanted to share with you some numbers. As of Monday, December 13th, 67 of our beds across the system were temporarily closed because of staffing challenges. Most of these have been between Handyford Hospital in Detroit, which had 44 closures, and Handyford Wyandotte, which had 21 closures. Together, these hospitals account for more than 1,550 beds. So the number of closures is relatively small. And while we want to have all our beds open for our patients, we do not feel that this is the bigger issue. The bigger issue that we have 500 inpatient COVID patients with COVID in the hospitals at the present time, and the number have continued to rise. And this is impacting significantly our staff, our care, and the ability to provide the best care to our patients going forward. And this is a crisis that we have witnessed as a healthcare system, but almost every hospital in the state and many hospitals around the nation have been talking to. The next thing I would like to talk about is the Omicron. And all of us have been watching and following the data regarding Omicron, both nationally as well as globally. In Michigan, as well as around the nation, Delta continues to be the dominant variant. But in the past week, we have seen a significant surge in the number of Omicron cases that has been diagnosed. And we anticipate these numbers are going to continue to go up based on what we know. There are over 77 nations now that have diagnosed Omicron variant in their population. So because of the fact that we are already seeing it and we are seeing surges in places like New York and New Jersey, we anticipate that these numbers are only going to continue to climb in our state. There is much more to learn about Omicron. What we have learned, and based on some study that was published yesterday from South Africa, based on their experience, is that their patient population seems to be less sick when they are infected with the Omicron. But we need to be careful with that information and that data, because their patient population is a younger patient population. Many of them have been exposed to the prior infection. So many of them have had some immunity from prior infection, and a significant number of them are unvaccinated. So we really are dealing with a different patient population. The information that we'll be getting from the United Kingdom and from other places around the nation is going to help us, because there are populations more similar to ours, where we have an older patient population and our vaccination rate is a little bit different. What is encouraging, and at least this is early information, that while the Pfizer vaccine and other vaccines might not be as protective against the infection by the virus, so people might still be infected, but it seems to be significantly protective for hospitalization and death. This means when people get infected with Omicron, they might not be as sick and might not need to be hospitalized. Another thing that is important for us to also learn more about over the next few weeks, whether a booster vaccine will help increase the antibodies and provide more protection with respect to Omicron. The last thing I wanted to touch on is related to the new pill that Pfizer at the present time has advanced for EUA. We are also excited about these other options for treatment for us, because they will allow us to treat patients out of the hospital and continue to keep the resources in the hospitals for other patients who are acutely ill, even either with COVID or with non-COVID related conditions. I just want to finish with one statement. On December 17th, 2020, we were extremely excited that we had vaccines that are available, that we are able to be spreading and using across the nation so that we put an end to that crisis. Unfortunately, today, we are in as bad of a situation, in fact, worse than we were a year ago with respect to our numbers within the hospitals and across the hospitals in this state and in other states. And part of the problem is the fact that we did not hit the vaccination rate that we wanted. And people can argue whatever they want to argue, but the reality, the science and data speak for itself. Our current surge is related to the number of unvaccinated people we have in our community. I will turn it over to Bob.
Thank you, Dr. Moncara. The unfortunate reality right now is that no matter which hospital you're talking to, no matter what health system you're talking to, the word that you're going to hear about current conditions in the state of Michigan is crisis. We are in a crisis. There's no way around it, and there's no way to sugarcoat it. On any given day, our emergency departments are either at capacity or close to it, and oftentimes serving as inpatient units because we don't have any beds available in our standard inpatient units or our ICU. There are many, many sick people coming through the doors, and majority of them are with COVID. Our worry, of course, is that as we gather for the holidays and we're all exhausted of all the protective measures, we totally understand that things could even get worse. Now, we do know that some people are coming into our very crowded ERs just to get tested for COVID, and that is creating additional strain on the system. We do not offer walk-up testing in our ERs. If you think you have COVID, it's vitally important that you do get tested, but we're asking people to visit one of the many testing sites around Southeast and Central Michigan rather than coming into hospital ERs. Again, this is for testing, and that includes using pharmacies, drive-through sites, which typically have the ability to take care of you on an immediate basis for testing. Combining our soaring COVID numbers with existing staff shortages that have only been made worse by the pandemic, we've got a very troublesome situation. So we want to be clear, if you need emergency care, do not hesitate. Please get to our emergency rooms in a prompt fashion. We are here for you and we will provide that care. But if it's something that can be treated or addressed with your primary care physician or even at an urgent care center, please consider that first. I want to talk just briefly about an issue that I don't think has had enough cover yet, and that's about the economics of this COVID crisis. And my real reach out is to individuals that have decided that COVID doesn't affect them, or COVID is not something that they are worried about, and therefore they've made a choice not to get vaccinated. So if you're primarily motivated by economics, consider this. The economic toll of record-setting COVID hospitalizations is significant. This massive number of hospitalizations has led to healthcare team member burnout in record numbers, which has led to accelerated resignations, which then requires health systems to use all sorts of overtime, bring in temporary agency help, bring in crisis labor, and those are unfunded. In addition, health insurance claims based on soaring COVID hospitalizations are going to provide medical loss ratios in the insurance industry that are going to be challenging. All of that ultimately is going to have to be passed on to consumers. So we will be footing this bill every month we do not get COVID under control. So hopefully for those that just look at things as an economic issue, they will join us in seeing that part of getting COVID hospitalizations down is also going to result in at least controlling the premium increases in the healthcare costs that we are all going to experience as a result of this vicious cycle that we're in. On another note, hospital leadership throughout the system are evaluating capacity and staffing levels multiple times a day, and we are making some difficult choices. For instance, last week, there was an entire day where Allegiance Hospital had to postpone all of their non-urgent sensitive procedures and surgeries. Some of our other hospitals, including Henry Ford Hospital, have also had to make those tough decisions to delay some non-time sensitive procedures or move them to other locations. We have been keeping those to an absolute minimum, but it is incredibly stressful and more difficult to do, and will be challenged even more as we go into the holiday period when our team members, who are human beings, are going to need a break and need some time off the way any other team member in any other industry would need. Our frontline team members are giving everything they have to this fight. And as I've said before, they're exhausted. I wish we could walk the halls and tell them we're nearing the end. There's light at the end of this tunnel, but we know we've got more work to do before we can make that claim. I think it's crucial that we share the stories from the front line. So I'd now like to bring Dr. Jackie Flom Carlson to give her perspective on what she's experiencing in the ER and ICU. So welcome, doctor. Could you please just begin by introducing yourself? Tell us where you work, what you do.
Good morning. Thank you for having me. My name is Jackie Flom Carlson. I'm one of the emergency, internal, and critical care physicians at Henry Ford Main Hospital. I trained here. I've been here for 12 years and had the pleasure. I currently split my time between the emergency department and the ICU, and I'm rounding in the ICU right now.
Why don't you tell our media partners how COVID plays into your daily work and of vaccinated versus unvaccinated patients?
The vast majority of my patients in the intensive care unit right now are unvaccinated or vaccinated with coexisting medical issues or immunosuppressants. In the emergency department, as you mentioned, we're extremely overwhelmed. The numbers are high. Physicians and nurses, techs, all of the support staff are exhausted. And in both of the fields that I work in, there's not much of an escape from COVID right now.
Recording in progress.
I think the beauty of working for Henry Ford is that the teamwork and the in it together mentality. In the beginning, we all really pushed each other. You know, we can get through this. You'd make eye contact across the room with somebody who was struggling, and you'd feel the tears coming, and you would talk each other down. And I think we're all still trying to do that with each passing day and each increased patient load and each death. It gets harder and harder to maintain that positive attitude and maintain that hope.
Maybe my final question, and then I'll turn it back over to Dana, is, you know, what's your message to the community? What do you want them to hear about what you and your other team members are facing?
I think I probably have a two-pronged message. The first is get vaccinated. For us and for you and for everybody who loves you, to preserve their sanity and keep you with us, get vaccinated. And for you know, the world, I guess, have an understanding that things are hard, and we are doing everything we can. We're doing our absolute best to keep patients in good care and to have a little grace and consideration in how devastating things are right now.
I really, really appreciate your insights and for what you are doing on a daily basis, not only as a clinician, but in support of your fellow teammates as well. And with that, I'll turn it back to you, Dana.
Thank you, Bob, and thank you, Jackie and Evan. Jackie, actually, before I turn it over to the media, could you describe to us how it feels to see an ICU unit that is almost entirely full of unvaccinated patients, COVID-19 patients?
I think that it's heartbreaking because we know that the patients are led astray by this social media or false information, and it's so heartbreaking to walk them down this path of death, knowing that it was preventable, and watching their family members have to go through this. It's heartbreaking. I think the majority of patients that I've talked to who are sick with COVID, who did not get vaccinated, have one regret, and it's not getting vaccinated. They all had different reasons. For some of them, they didn't have time. They didn't want to take time off in case they felt sick from the vaccine. Their family member told them they should get it. They all have different reasons, and they all have the same regret.
Thank you so much for that. Thanks for being with us today. We really appreciate you. I'm going to